Thank you, Chairs. No conflicts. The aim of our study are following. There have been no studies which investigate the relationship between LUTs and testosterone level following withdrawal of dutasteride. Some studies have reported that increase of testosterone after administration of dutasteride can be beneficial for stress symptoms of BPH patients. So we conducted this study to make sure the outcomes of BPH patients following withdrawal of dutasteride. This is our study design. We evaluated the withdrawal of dutasteride every 3 months. The study variables were IPSS, urinary flow, prostate volume, PSA, and total testosterone. This slide shows the baseline patient characteristics. The total number of patients was 47. The mean IPSS was 10.7, and it means that the degrees of suffering from LUTs is moderate. This slide shows results of IPSS. In all of the patients, IPSS total, IPSS stage, IPSS voiding, and quality of life score have not changed significantly. Prostate volume and PSA increased. Total testosterone decreased significantly from 3 or 6 months study period compared to baseline. We divided the patients into 2 groups. Group A is characterized by IPSS voiding symptom deterioration. Group B is characterized by IPSS storage symptom deterioration. And the variables between the 2 groups have not shown any significant difference. We further evaluated the study variables of Group A and Group B as same as the last one. The total testosterone decrease from the baseline is specific to Group B, IPSS storage symptom deterioration group. Significant change of prostate volume and PSA from the baseline can be seen in both of the groups. This is a summary of our results. Following the withdrawal of dutasteride, IPSS total, IPSS voiding, IPSS storage, and IPSS quality of life didn't significantly deteriorate in all 47 BPH patients. However, some patient symptoms significantly deteriorated. When dividing the patients into 2 groups with IPSS voiding and IPSS storage deterioration, total testosterone decrease was specific to the group with IPSS storage deterioration. A previous study reported significant improvements in storage symptom score in the total testosterone elevated group after add-on dutasteride. The relationship between total testosterone decrease after withdrawal of dutasteride and deterioration of storage symptoms have not been proven yet. In conclusion, our study suggested that deterioration of storage symptoms was affected by the decrease of total testosterone after the withdrawal of dutasteride. These findings provide further insights into the management of BPH LUTs patients who have been treated with dutasteride. Almost all patients could safely undergo withdrawal of dutasteride treatment. However, medical professionals should carefully monitor patients for events such as acute urinary retention. Thank you for your attention.
Thank you very much also for the time you spent for your presentation. That leaves some minutes more for discussion. Is there any question from the audience? This is very interesting topic, and it's quite a novel topic actually. So suggestion is that testosterone do have a bladder effect. Total testosterone do have a bladder effect
lack of effects.
Yeah. And my question is first about this population of patients. I found that baseline level of testosterone was not so high. So my question is, did you exclude patients with low testosterone syndrome at baseline before recruiting them?
We have not checked the testosterone, consider about the baseline patient's testosterone level, but I can say that the baseline total testosterone is very high, and the rate of decrease of testosterone is very high. In that case, the storage symptoms may be susceptible to the testosterone decline. The storage symptoms may be significantly deteriorated. Yeah, I think so.
And is there any room, in your view, in the future to suggest also testosterone as a treatment or a co-treatment in patients with lower urinary tracts, and in what kind of patient?
We are considering about withdrawal of dutasteride whose symptoms have been stable for a long time, and we are considering about intermittent administration of dutasteride. At least 1 year may be suitable for the patients because they have almost no symptom deterioration in all of the patients.
Okay.
I mean, I'm not familiar with this. Are you suggesting that dutasteride causes an increase in testosterone? Is that what you're suggesting? Or is the fall we're seeing simply a normal change with time?
Yeah, after withdrawal of dutasteride, the process volume gradually increased, and it may influence the symptom of the BPH patients, especially the voiding symptoms. But we have been very interested in the storage symptom deterioration after withdrawal of dutasteride by testosterone decline.
But do you think if these patients hadn't been on dutasteride, as they got a year older, their testosterone may have declined anyway?
Yeah.
It's possible, so we don't know that.
Yeah, I think it's possible.
Okay. Thank you very much.
Thank you very much.